In rural Bangladesh, three separate kinds of field-based health workers provide services to the same women, children, and families. Each of these groups is primarily responsible for a separate set of activities: vaccinations, family planning, and antenatal and postnatal care. To support these services, each set of workers conducts population, household, pregnancy, and birth surveillance, time-intensive work that's required to ensure that everyone in a catchment area receives services. They also spend a significant amount of time each week compiling data from register booklets to create reports for their supervisors. Sadly, health workers in this setting are set up to fail, unable to provide timely, high-quality services to their overwhelmingly large client base. In such a setting, the duplication and even triplication of effort leads to the hardest to reach clients, those living in the proverbial last mile, being chronically missed. This last mile health system will strengthen the delivery of basic health services through data sharing to those who need it most, people living furthest from the clinics, with the fewest resources or the least education. Instead of focusing on individual workers, we will empower teams to work together to build the population, household, pregnancy, and birth registries they need, while they continue to see the schedules, reminders, and forms optimized for their own unique responsibilities. We have all the ingredients for success, including government partners and a decade of working in Bangladesh, where we propose to launch this study and demonstrate impact.
Community health workforces in developing countries are often disjointed, redundant, and understaffed. When resources are limited, this kind of inefficiency can cause essential health services to be missed and ultimately lead to high rates of disease and death. We're developing a system to allow different workers to share essential data, optimizing coverage of health services, and making sure every mother and child get the care they need in rural populations. Combining simple software with worker training and data-driven motivation, we aim to make sure no child or mother is left behind.